So we started this journey about 4 years ago, and for us, it was all about reimagining the role that our institution is playing in our community. And we were highly motivated by the fact that, our mission is about improving the health of the community. We know that the social determinants of health contribute about 3 times as much to an individual's health than the great healthcare we provide. So we felt like we weren't being authentic to our mission unless we're getting outside of our walls in a more conscious and intentional way, in a way that is built right into our strategy. And so we did that by adopting an anchor mission, which in our case is primarily about leveraging our organizational assets to address social disadvantage and pervasive inequality. And we do it in 3 basic ways: through using our investment power, our hiring power, and our purchasing power. The priority was based largely on our community health needs assessment, what we saw in the community, what we know from a number of other sources of information. Housing was at the very top of that list, so we started with housing. Housing also was more comfortable to us, particularly our investment committee, because we have a secured asset if anything went wrong, and I think they felt more comfortable out of the gate having that. So we've invested in chronic homelessness. We've invested in affordable housing.
One of the things that's unique about Providence is that we have our own public housing division. So we've understood this correlation between housing and health, and shelter and health, as being part of what we do. We also have an education division. We have still are probably one of the only health systems that still has its own high school, university, but we really understand the linkages between education and health as well. So we consider those part of what we do.
So for a number of years, we honored our commitment of our community health needs assessment and made small grants to safety net organizations in Santa Fe and northern New Mexico. When Anchorum St. Vincent became an impact organization over the last 3 years, they made a decision to direct some of their corpus, some of their funds to partner with us, to match with us in doing deeper investments in our community to truly address those areas of concern in the community that were impacting our patient care within the walls of the hospital. So we focused on super priorities, but really what we've done is we've evolved to a community funding alliance. It includes also a local nonprofit, so that the 3 organizations are making shared investments, deeper investments that can create sustainable change in Santa Fe and northern New Mexico. And it's really looking at the lifespan, everything from affordable housing to food insecurity, women's health, senior health. It really does run the lifespan of our investments.
We tend to look at everything with a 2025 vision. Where are we going to be in 2025? So when we ask the question about community involvement, the question comes up, where will we be in 2025? And the answer to that one simply is we're going to be there, and we're going to be there in a stronger way, because we believe that healthcare is really moving out to the home and to the community. So following where healthcare is going means that we have to be even more involved in those communities and really working together as we go forward. So we see this as a natural evolution of where healthcare is going. Primary care, community involvement is going to be part of what we're going to be doing. And, population health is a division unto itself at Providence. We see that as where the future is going. And that's this whole movement as we look towards value-based care. We think that's going to be better community care as well, because the real metric there will be, what is the health of the community? And what I would hope in 2025 is those communities in which Providence is involved, we could say that the health of the community by markers has gotten better because we're there.
So the chief controller of our organization, who's an individual who supports our investment committee, is co-chairing this investment effort, and we have our VP of Community Benefits on that team as well, including several others. And so we're bringing both a knowledge of the community and community organizations, as well as some fiscal prudence in terms of making sure we make the right investments.
I think in all health systems, we worry about our silos, population health versus the hospitals versus something else. And then, as we all know, what gets funded gets done. And how do we deal with all of that? So it all starts with my partnership with our chief financial officer. And I just happen to have one that really, Greg Hochman, that really understands our communities well. And we understand that we consciously have to put capital and money towards different things. That's why, whether they're community projects, whether they're hospital projects, we consciously, looking at our plan, look at where we're going to put those dollars and commit those funds. But if you don't do that consciously, it won't happen. And then the second thing is that the left hand has to talk to the right hand. So population health is intimately involved with the community involvement programs that we have, but also our people in our hospitals are also well aware of what we're trying to do in the communities that we're serving there. So all of those pieces fit together. Communications gets to be part of it, but you have to be prescriptive in terms of what you commit, particularly as it relates to what you fund.
And I think it's vital to get the board involved. And I'll say is what I have observed is that this is very much in the board's sweet spot. You know, many board members come to our organizations because they have a real interest in helping the community and giving back. And some might have healthcare experience, but most don't have deep healthcare experience. So when they hear the opportunity to leverage our organization to lift up the community, they tend to get very excited and inspired by that.
We have a committee of our board called the Health and Wellness Committee. So that includes members of the board of the hospital, including our Anchorum St. Vincent folks, but also community leaders that are very familiar with the efforts happening in the regional community, and they bring that knowledge and experience to that board. So it really enriches the conversation, understanding of what we're trying to accomplish together. It's been really key. And then, of course, all of that activity is reported up through the full board. And so when you have board members having a conversation with other leaders in the community that are trying to do this very same work, I think it leads to a much greater appreciation for what it takes to really care for an entire community. It makes it personal, so it transcends the business reasons. It really becomes personal and critical to just the community in general. What we have learned over the course of the pandemic, more so, is our need to really understand the real diversity even within diverse communities. So, for example, during the pandemic, while we are very familiar with what it takes to really care for a Native American population, we were challenged to learn what does it mean to care for a Navajo population, which are predominantly from the southern parts of the state. But by leaning on our spiritual care team within the organization and in our surrounding communities, we were able to provide really wonderful spiritual support and compassionate care to that patient population. The social determinants as we come out of the pandemic are going to be even more stressed.
I think everybody in our organization was really proud of how our caregivers stepped up. And, you know, there were a number of reasons for that, but my view is that our focus in the last few years of becoming an anchor mission and making it a part of our strategy, it almost allowed people to see our organization in a much broader way and realize that the community is part of us, it's part of our mission, it's part of our responsibility. And so I think that what we've learned in the social justice conversations that we've had over the past years and some of the awful things we've seen, what we've learned in what's happening in COVID has given us renewed dedication and focus to do this kind of work and to really get at the root causes of pervasive inequality, and social disadvantage, because they're real, they're right in our communities, and we actually can do a lot about them. So that's my hope for the future.
Well, I touched on it very briefly, but about a year and a half ago, we added to our co-investment strategy another partner, the Santa Fe Community Foundation. They too were making rather important investments in Santa Fe and northern New Mexico. And often we found that our efforts were duplicated rather than collaboratively woven together, really still in the early phases of what it means to do collaborative investments among 3 organizations. And our dream was to get to these 3 so that we can show how channel targeted investments can really transform a community. And we couldn't do this work without Ancorum St. Vincent, because we've been able to leverage the dollars we had as a health system with our partners' investments. We have been able to reach in deeper into this community, and it really speaks to developing high trust environments, high trust relationships, and a real commitment to collaboration, and in a long-term commitment to collaboration.
One of the things that we're really, really sensitive to is not coming in with a heavy hand saying that we've got all the answers, because we don't. There are a number of community service organizations that exist out in our communities that have been doing a lot of work around homelessness, around hunger, around education, that are clearly have to be our partners together as we look at these problems. So it's also that sensitivity of knowing what community organizations that have been doing this work for a long time can be really great partners as we move ahead.
We're thinking about is creating what we call an anchor district, which is we're focusing on a particular small area within our city, and we're going to try to bring a number of resources and organizations to have kind of an intense effort of relocating there and combining all of these 3 anchor elements: hiring, purchasing, and investing, to see if we can, in a concentrated way, really turn around a particular neighborhood one at a time and experiment with that, and obviously bring that to scale if we can be successful.
We've been blessed with a big health system that has a lot of resources. If I'm talking to a smaller health system, a smaller rural hospital, it doesn't matter. You can really get engaged with your community. And I've seen some of the smaller institutions have some of the most significant involvement with their communities. And it's really about partnership. It's about being able to work together. And then I think it's as we use the expression, let's not boil the ocean. Start with a few projects, start with a few things that are measurable, that you can see a significant difference in. And the hard thing is really figuring out where to start. And the where to start should be a collaboration between the community and the hospital and health system together to figure that out. But I always say, start small, start with something that you can measure, and then it has a way of growing upon itself.